everybody. This is Brenda Green, and thank you for joining us again for our next Tuesday chat. And we're so excited to talk to you tonight about another very important topic. Again, I'm Brenda Green, founder and CEO of the Be Strong Group, founded in honor of our son Braden, who has sickle cell disease. And our mission is to spread awareness of sickle cell disease through education, advocacy, and empowerment. So I am so excited about our topic tonight. If you saw it, it's about self-advocacy and improving your healthcare experience. I know as a mother of a child with sickle cell disease, this is very important topic for me, but I'm sure it's an important topic to adult sickle cell warriors and anyone who has to navigate the healthcare system. So I'm honored because we have a special guest, and her name is Denean Greene-Rivers. She is a global patient advocate. She's a medical social worker and motivational speaker. Her expertise is maximized through the Carolinas and beyond, with emphasis on minority health disparities and equity, children's health and wellness, with the focus on the medically fragile, and closing customer service gaps in the healthcare industry. Now, Denean currently serves with Prisma Health, Midlands Children's Hospital Family Advisory Council, and she's on their Patient Care and Safety Committee. She also serves as chairperson locally here on the School Improvement Council for Richland School District 2, the Blythewood High School, supporting more than 2,000 students and institutions administration. Denean's community service spans more than 30 years, and we're so excited that she's here tonight. Denean is a wife and a mother of amazing children, and I hope that you help me welcome Denean Greene-Rivers as she discusses tonight very important topic. Hey, Denean, how are you?
Oh my goodness, I feel so honored.
Oh my God,
I am
I am.
I am well, thank you, and I'm excited to be here, and it's certainly a pleasure to be with you always, Brenda.
Oh, great. And and I'm so excited because actually I met Denean in these, what I would call these advocacy streets. And on my journey of being an advocate for my son, that's where I met Denean. And I know I mentioned in your bio that you serve on the Prisma Health Midlands here, Children's Hospital Patient and Family Advisory Council. So that's where I met you. And what a blessing that has been. And so, Denean, can you just share? Let's just jump right in and share with
Let's do
everyone
it.
listening. How do you even get started in advocacy?
Oh, wow. I
Yeah.
think that advocacy is something that's innate. And I also think that everyone has a little bit of an advocate inside them. So either you're advocating for yourself, or you're advocating for a family member, or you're advocating for a close friend. And so I think anytime that you see any injustices done, or something doesn't feel right, or people are being marginalized, or to put it in simpler words, if something does not feel right to you, if people are feeling or being mistreated, and you are deciding to step in to make a positive change, then you are in the role of advocating. And so it is so easy. It's much easier than people think. I think you just have to be led by your heart and your mind and your passion. And it's truly mine in the healthcare industry.
And see, so our topic really tonight can touch and impact many across, many backgrounds and situations. So this is a conversation for everybody.
Absolutely.
So let's touch on a little personal. Tell us about your advocacy journey or role as a mother. Do you want to just touch on and share your story?
Oh, sure. So, well, I am the mother of five beautiful, wonderful children. My oldest, believe it or not, is 31 years old. I always get her age wrong because I want to sometimes feel a little younger than I really am. But she is 31 years old, and my youngest is 9 years old. So I have 31, and I have a 29-year-old son, a 17-year-old, a 12-year-old, and a 9-year-old. So every walk of life, I have seen it, I have been it, and I'm living in it. But I have one unique child who had some healthcare issues very early on in life. He was born premature in the same hospital of which I was born and laid my head. And that is with Prisma Health now, but back in the day it was called Richland Memorial Hospital. And he developed something called necrotizing enterocolitis. And basically what it is E. coli of the gut. Little holes perforated his intestines, and he became septic. The bowels leaked out into his bloodstream, and he was really sick, really sick. And we were quite afraid that we were going to lose our son. But because of my role in medical social work and mainly my faith in God and my role as a parent and a mother, you get these endorphins that kick in and you want to fight to make sure that your child, especially a child who's chronically ill or a loved one, gets every service that you can possibly find to sustain their lives. And so that's what we did for our son. It meant us working with the transplant team at Georgetown University Hospital in Washington, D.C. And we waited on this transplant list for intestines. People get shocked when I say it. They don't believe it, but you can transplant a whole lot of organs. So we often think about kidneys and heart and lung, but we don't think about the stomach or the bowels and the intestines or skin or eyes or other organs. But for our little boy, it was his intestines. And we had oh my gosh, it was a long road, and I've learned a lot in that journey. And the main thing that I learned is that I am the owner of the team. My son is the star player in this healthcare team, and I'm the owner. I had to start taking this woe is me syndrome out and still use my mommy hat, but in a different way. I had to learn to advocate for my son differently. And so the angle in my approach changed. And hopefully I'll share a little bit of that with you today. And because that angle changed and partnerships were made between hospital systems, very big hospital systems and teaching hospital systems, we have now a successful outcome. So our son DJ will be 13 years old in August, and he is a transplant recipient survivor. He's on a ton of medications. We still have some little bumps in the road here and there, but I am a witness that you can have a healthy, positive outcome for your child and your loved one if you do the advocacy work. If you put in just a little bit of work with a lot of heart. And so, but that's a quick snapshot of our story, and it has led me in the role of patient advocacy with pediatrics. And this is how Brenda Greene and I have met, with serving on the Patient and Family Advisory Council in the hospital setting here in Columbia.
Oops, I'm sorry. I was on mute. That was a lot of good information, Denean, and that just shows, I think, a lot of us who come on this journey of advocacy, we all have a story, and you definitely have a powerful story. But along with that, and our three words is education, advocacy, and empowerment. Okay, so tonight we're definitely going to you're going to share some of your tips, and so that we can speak on the topic of advocacy, and all of this education and information that you'll be feeding our listeners tonight will add to that empowerment. You feel empowered when you know some stuff, some good stuff that can help us navigate. So this is a good one. So, and I love your scenario about it being a team. And I know in previous chats, we spoke about the importance of feeling as if we're on the medical team, and we are. And I'm glad you said that, because I am an owner of my team. So that's a great one.
Yeah. Well, let me share a little bit about the ownership, because sometimes when you say team, everybody has a different version of what team looks like in healthcare. And so I'm on a mission for patients and families to look at themselves, like I said, through some different lenses. We all have grown up with maybe some older family members who have a certain reverence for doctors, or we get a little shy and reserved. We shrink back. We don't necessarily know how to talk to the doctors or ask questions. And oftentimes we're coming back home and we're sharing with everybody else in the household and the community. We talk about what we miss because we feel like maybe we don't measure up to the doctor's standards. So I like to switch it around in your head. First of all, I don't necessarily consider myself a patient or my son, because to me, patient has two different meanings. So you can be patient, and too many times and oftentimes, and I'm a Black female in this Black world with my Black family and my Black child, and we have patiently waited a lot of times on healthcare to come and meet us where we are. So the word patient to me means that it's stalled, that I am waiting for someone else to come to me to assist me. So I like to think of myself as more of a consumer in healthcare. And that allows me to take more ownership in choosing my providers. So I'm going to move back around maybe to talk about ownership. So ownership means that you yourself, mom or dad, caregiver of your child, you own, or the DNA, your documentation, your paperwork that you sign says that that child is with you. That child is yours. You are front and center with that child. That the ultimate decision making for anything concerning your child or the chronically ill loved one comes from you. Okay. So when you start thinking about, the doctors are in control, but at the end of the day, my son has my DNA. I adopted that child, or that's my foster child. I'm the one ultimately signing and making decisions for this pediatric little boy or girl. So if you think like that, then you should start thinking, I'm the owner and my child is the star player. So in the team, those of you that like football or basketball or baseball, let's think collegiate or national level. On the national level, the teams have owners. Now, the owners don't necessarily make the game plays or the calls. However, they take care of the monetary means, and they have a voice and say of who's going to be on the team, who the star player is, and what coaches will be working with these members. So if you, mom, are the owner, you get to choose the providers working with your child. Okay, let me just say that again, because we in Columbia, South Carolina, and most people think, well, we just got, this one children's hospital. I don't have a choice. Yes, you do. You have so much power. And even if there's one children's hospital in your area that you can get to, your voice rings so powerful as the owner, because you're paying. So I get questions about, well, what if I have Medicaid and Medicare and the state pays? You're still responsible. If Medicaid doesn't pay, if Medicare doesn't pay, if your commercial insurance doesn't pay, guess who pays? If you are homeless or you're indigent, some paperwork has to get done, and it's not going to be your child or somebody else. It's going to be you, the owner. Okay, so if you're the owner and you're in charge of the bill that's coming and all the charges that you incur in healthcare, then you also have a stake as a stakeholder in the star player, who is the child. So, well, let's look at, well, where do the doctors come in? Well, just like on an NFL team or a basketball team, You have the owner, you have the star players, but you have to have coaches. So I think it's important for us to switch and start our thinking differently to see our providers. And providers for me means anybody in the healthcare industry who is providing a service. So some people have doctors, some people have nurse practitioners, some people see, the nurses regularly, or you go to the lab regularly, or you're getting tests run by different people in the radiologist department or other services. So anybody who's providing a service, they have a role. You're the owner, your child is the team player, but you get to decide who is working as the coach for your child. So you can choose or decide how you're going to be communicating with those coaches. You don't like the coach on your team, guess what happens? You get rid of them. You just move along nicely and you find your new coach. You also want to make sure the coaches on your team are all communicating. So whether you're a sports enthusiast, or not, we know that there's usually more than one coach. You've got your conditioning coach, and in football, and I'm not a football connoisseur, so guys, don't send in the chat box that I'm saying something wrong. You help me on this. But, but usually you have an offensive coach, you've got a defensive coach, you've got the conditioning coach, you've got, look at USC alone. They probably got about 15 different coaches on their roster.
20.
So, and they're getting paid. They're getting paid to do their job. And if they don't do their job, if the head coach or the owner isn't doing their job, then the school quickly releases them. So I don't want people to be afraid, and I'm not necessarily advocating you release people. What I'm advocating is that you do the work to research who's on your team. If you want your team star player to be successful in healthcare, you need to research and know all the background information about your team members, all of those wonderful providers. So just shift your thinking a little bit. It makes you feel empowered to know, number one, that I am taking care of this child. I am at the forefront in helping in the decision making. I am the owner, and this is always my team player. This is my star player. So if that person is your star player, then everybody that you put around to work with your child should always have your child's best interest at heart, and they should be communicating well with one another so that there is positive outcome for your loved one. So that's my little tidbit about being on the team, Brenda.
Girl, that is way more than a tidbit, okay? And we have to realize that as parents or as caregivers, we are more than qualified to be that owner, okay? We have to recognize. And I know one of our listeners who's listening tonight always said, because like some of us who, like Braden is 15 years. So I have 15 years of experience under my belt with dealing with a child with chronic illness. And I have a 26-year-old, so I have 26 years of experience of raising a child. So we are more than qualified to fit that role. Thank you, Denean, for saying that. And I know one key word you mentioned, well, one of many, power.
Absolutely. And there's so many different ways. And let's take into consideration that there may be some parents who maybe they're new parents, maybe they're first time parents, maybe they feel like they are powerless in a sense, or that they don't know enough or a lot. So even as the owner, sometimes you don't know all of the plays, and it's okay. You weren't hired to know them all. That's why you got the doctors. As the coach, it is quite all right to step back and learn from the people you've hired. You do not have to be the end all be all. We know that you are the head person in charge in your home, and that those doctors and those providers, everybody on the team still needs to look for you for certain leadership, because you're with your child 24 hours, 7 days a week, even when you're working. Parenthood never turns off. even with my 31-year-old, she doesn't live here. It never turns off.
Nope.
So yeah, I think it's important to say that we don't diminish how much you know or how little you know in your decision making. You are just as important.
Right. And, and I know you mentioned again in that your message of power. What message would you like to share with patients and or caregivers or families about power? I know we've been talking before, and you have a very good message about the power of the pen, the power of the voice. So that line of power.
I talk more about the power of the pen because part of my job and most advocates are is to try to educate and be the voice for the voiceless. You hear that a lot across the board. So maybe sometimes as the voice for the voiceless, we don't always get the specifics across because we're trying to capture and advocate for so many different families and people across the board. So I've started to push out the notion of the power of the pen. The pen is mighty. It is so mighty. So we all often think about, the sword and the shield. Well, your sword is your pen. It is your mighty pen is the sword, and your shield can be your simple notebook. It doesn't even have to be anything fancy. That the little small memo pad that you can get from Dollar General or the dollar store or a notebook or a piece of paper you just get out of your home. If you don't have any paper, then take the blank side of an envelope when you go in for every appointment. And I'm just saying that if it's an emergency appointment. You don't have a pen, ask for one when you go to your medical visits or when you're in the ED, which is the emergency department. And this is important for several reasons. First of all, a lot of times folk don't always have the questions in their mind when they're at the appointment. You either remember the question when you leave or you think about it before you go, and then it just kind of goes out the window because the doctors are coming in. They've got a few minutes to rush through and get to the next person. And typically they ask you, well, how's it going, mom? Or is there anything you want to share? And we've been sitting and waiting. So a lot of times we as parents are ready to go. But I think it's easy for us. It's much easier if you decide that you're going to document and write down your questions and your concerns ahead of time. If you don't know what to write, then contact or talk to someone else who has a similar issue or a concern, and maybe they've been going to the doctor for a long period of time, and ask them, what do you ask the provider when you go? What do you talk about? What are some of the hit or miss things that I should be considering when I see my child's physician? Another thing I like to tell people, if you feel like, well, my penmanship isn't good, I don't write very well, maybe you have some sort of literacy issue, it's okay. If you don't do anything else but take your pad, hold it up to yourself so that nobody else is looking in, and during those appointments, pretend like you're doing something. If you got to connect the dots, draw you a picture while you paying attention, or you write down the name of the person who is servicing you at that time with your child. That could be the nurse, the doctor, the front desk person. You should be documenting. One of the easiest ways that I like to share is to write down a red side and green side on your document. So when you open your notebook, you can just simply write red, draw a line down the middle, and write green. So red means stop, hold up, something is not right. And green means, oh my gosh, I had a wonderful visit with this doctor. Two reasons this is important. The first reason is if there is a problem on your red side, you need to have the person's name who you have the concern with. I don't care if it's the last name. A lot of times we get caught up and we just say doctor, and it could be a medical student. It could have been a nurse. You don't know what year residency in the teaching hospital this person is, what year they're in. So I think it's really good if they don't have their badge on or it's turned backwards just say, "Can you give me your name, please?" And write down the name as best you can to your memory. Also, timestamp. And what I mean by that is you should be writing down when you've had to go to the emergency room or your doctor's appointment and the time that you got there. So people say, "It's in my phone. They called me." Well, if an emergency happened, you didn't write down or put in your phone, you go into the emergency room. So if you have to go to the ER, you need to be writing at 6:26 p.m. on July 20th. My child and I entered the emergency room. That's important because you want to be documenting how long it took you to even get to the back if you're in a crisis. That way, when you go meet with your child's provider, you can share about not just the length of time, because length of time could mean you in the back getting some services, some labs, or you waiting to be sent up to a room. And I think it's really important. And sometimes we forget to even document the amount of time we wait in the waiting room before we get to the back. We want to make sure that when our kiddos aren't well, that we have an easier approach to maneuver through the emergency room. And if you have a sick visit and a scheduled sick visit at that with your provider, that you're documenting that. I tell people to look at the parking lot. Y'all gonna think I'm so silly for this, but if you got a problem with parking and you can't get into your doctor's office, you should be writing that down, because all of these large institutes and doctor's offices, they make a ton of money, they get a ton of money, and they are actually looking for ideas to make their services better. So on the red side, if you find anything from the parking lot to the weight room to the bathroom to the patient room that you see could make your life a little better and other patient and families' lives better, write it down and share it. Share it. And if you feel afraid to share it during the time with the doctors, when you get your survey, go back to the notebook, because we forget. You know, mamas, we got so much on our table. And like me, I tell people I'm blinking at 50. And so I get a little brain fog here and there. And so I have to use my trusty dandy friend, my notebook, to go back when I get ready to do the survey. And you don't know if somebody's going to reach out to you and say, "You know what, we really like your suggestion," or "We're concerned about the problem you had, and we like to ask you a little bit more about it." Do not solely just rely on memory alone. Document, document, document. Now, on the green side, and I'll move along with this, I think it's also important to write down who you're talking to. Because I'm going to be frank with you. I'll tell you a secret. I have my favorites. I have my favorites and my preference in healthcare. And the funny thing is, most families do. Like, you have your favorite doctor, or the nurse, and God forbid that nurse leave and she goes to another practice, because you develop a relationship and a rapport. So if you're in the emergency room or your doctor's visits or you're getting a procedure done and that person was awesome, they made your day. You were stressed. You know, they communicated well. You understood every single thing that was going to happen with your child. So, for example, if Stacy Edmonds was the pinnacle nurse, I want to document Stacy Evans. I want to put the time she worked, where I met her, because a lot of hospital systems have awards that they will give their nurses, doctors, and staff. So if you take a moment and document and pull for our hospital, the Children's Hospital for Prisma Health has something called the Daisy Awards. I am pushing for families to complete that. I don't care if it's 3 sentences. I like how she smiled. She thought about my son and straightened out the wrinkles in the sheets in the bed. She came promptly when I buzzed for a nurse to come in the room. She got us extra pillows and blankets. I mean, small things matter. And if you have to ever go back again, guess what? That nurse will remember you. But more importantly, when they get these awards, just think when you get an award. Do you keep it to yourself? No, nobody does. You usually don't. So if Stacy got the award in your doctor's office, she probably shared it with everybody, or that hospital system shared it. And so they're saying, who wrote it? Oh, Denean wrote it. So when Denean comes in with her son DJ, you're talking about red carpet treatment. So your doctors in the hospital system don't always want to know what's wrong. We should do a good job of telling them what's right too. It's important to do that. It helps you, it helps your child, it helps your provider, it helps with relationship building. And believe it or not, you'll probably get a little bit extra time and attention. I mean, it's just par for the course, and it's the truth.
Oh, it absolutely. And to be honest, you just promoted so much, especially one of the things that stood out to me is document. And of course, a lot of times, you know, as a mom of a child with sickle cell disease, I know I've been documenting since Braden started seeing his hematologist, as far as documenting, you know, vitals and things at home. And especially when we go into the ER, we're not going in the ER just to go in the ER, you know, we're going
Nobody
because
does.
you know. So sometimes when you're in that emergency mind frame, you know, like you said, you're not going to remember everything, but it's so important to remember to take those notes, jot it down. And I know there's a couple of times when I forgot my spiral notebook, and I have an app on my phone where I type the notes in there, my notes app. So, and then I would transcribe it back. But it's so important and to be able to come back to that information, because even with our documentation, how you say about participating in the surveys, it that also involves us. We become involved bigger into healthcare, their healthcare experience, our healthcare experience, and it impacts the experience of everybody else, especially if we're involved in that manner and we document and we share it, like you said. So
Absolutely.
these are some good points, and we try to encourage our families to, you know, complete those surveys that Prisma sends. You know, and
Oh,
it's
absolutely.
easier now, right? Aren't they sending
Mm.
it like electronically?
They do, and sometimes you'll get a phone call, but I do
Yeah.
want to share this. So, most of us have smartphones, whether we know how to use all the applications on them or not. Um, but in most doctors' settings, they typically don't like for you to record, take pictures, or spend too much time in your phone. I love the phone, and sometimes I may say, even for me, I'm taking some notes. And then, oh, we'll print it out, put it in a discharge setting. So even with your phone, don't just rely on the phone, because unfortunately, people think with wait time, or you've been in a room for a while, you're probably texting somebody, you're on social media. We've heard it all, haven't we, Brenda? Oh, they're always on their devices, they're always on their phones. They never even think about you could possibly be looking up something to help you and your child during your stay or your visit. So again, phone or not, take your pen and pad, arm yourself with power of the pen and the pad.
Oh, absolutely. That's great. So we talked about we're the owner. We talked about the power of the pen. We talked about why it's important for us to document our own health experience in a way. Is there anything else you want to elaborate on that part of the important, why it's important?
Well, why, again, or maybe I may not have mentioned this, but at the end of most of your visits or all of your visits, you'll get a discharge summary.
Mhm.
And typically it's condensed information. I try to make sure that whatever I've documented, that it's showing up in the discharge summary too. Or if you ever have to, and you should regularly, ask for at least the last 30 days of notes from your doctor. Because sometimes what you have asked and stated from your very own notes may not necessarily end up in the summary for the provider, for the doctor. You know, they're so quick, and sometimes it's shorthand. It could be a little hit or miss. And I'm going to tell you why that's important. And this is with my social work hat. If you ever need to apply for disability, you hear me? If you ever really need to apply for any services where you've got to share and discuss your issues or your chronic health state, if your doctor turns in their paperwork, of which a lot of times we don't even ask to see, you don't know what's in there. It might just be a quick line, something short and simple. And I'll give you an example. So patient comes in and they say, well, I've been having problems with my stomach and I keep going to the bathroom. You know, like something is wrong with my belly. I am honestly going to the bathroom. I've got loose bowels. Well, you don't want the doctor to just prescribe you something and say, you know, patient presented with these checkoff lists. Maybe what you meant to say is, doctor, I am constantly going to the bathroom. I have severe bowels that's making me dehydrated. I am incapacitated where I cannot go out and do my regularly daily work or activities. That is really, really important. And if you don't do that, then there is a disconnect from what you're saying and what the doctor says. Or here's another example. I've come across people who have, say, migraines in children, chronic migraines over and over again. So they might come in and say, well, I had a headache. I don't know. I just keep having these headaches. It's important for you to document how often you're having the headaches. How long are you out when you have the headaches? What medications have you tried so that you can tell the doctor, look, don't just send me home with Tylenol or Motrin or some of these other things. I've done it. And they'll say, well, but if you just did it right before you came, oh, no, let me just go back and tell you on these dates, every time I've had to take 2 or more, I'm unable to get out of the bed. Or my child is unable to function. My child is unable to go to school. They're saying they're seeing blurry spots. The head. You want to be able to specifically document all of these little nuances and things that you think the doctor already knows. You might think they know it, but did they write it? At the end of the day, did they write it? And if you have not asked for your doctor's notes again for the last 30 days, and it doesn't mean that something's wrong, see how your doctor documents your visits. Mm-hmm. You know, people, oh, well, got, the electronic medical records, I can go in there. It's only as good as what your doctor puts in. You're not able to write into the physician's notes in their direct notes. You may be able to send them an email and a message, but you want to make sure that it actually gets into your physician's medical notes. That's really important. So again, that's another thing that can help your documentation process.
Oh, that is so good. Denean, we have a question in the chat. And it falls in line with the power of the pen somewhat. And then we talked about communication. But the question is, what is a good way to express displeasure with treatment services right then and there? Like if we're in the ED, the question is on the screen. If it is something that you would prefer to address immediately instead of waiting for the survey, what's the best way to do that professionally and effectively? You have any feedback on that? Or some thoughts?
Absolutely. Yes, sure. So the first thing is I think you need to look at the severity of your displeasure. What exactly is the problem? Do you just need to address you don't have no sheets and a warm blanket in the bed? And you might be going home and they're not going to put you inpatient? Then that might not necessarily need to be your driving force to bring somebody in the room to talk about the television doesn't work. So I pick and choose your battles. And if you feel like your child or loved one going home could mean that they could spiral out of their own health consciousness, or they're going to have a severe reaction when they get home, or you've seen this before and it hasn't worked well. Again, you'll be able to go back to your notes and you can say previous visits, this has been prescribed to us, or in previous visits, we have been told to go home to do this. We've tried this. And you can say, well, I would like to have maybe the chief of staff come in. Are you the head of the ED? Who else is working with you? I appreciate your comments and your suggestions about what's offered, but I have some additional concerns. This isn't sitting well with me. Can we bring someone else in so that you have more than 2 or 3 people possibly saying the same thing? And let me tell you why that's important. Documentation. Because if one doctor comes in and, I don't know, it's a medical student, or it could be a second or first year resident, a lot of times they may be talking and trying to do decision making with other people that'll be outside, but they themselves don't come in. You want to know who else is over that person that you can talk to. Is this the consensus of everyone who's down here in the emergency room today? Who signed off on this? If this is going to be the plan for my child, who else did you share this with, or I can share this with, to make sure that this is the appropriate course of action for my child? Then they're like, well, but you might have to wait to get Dr. Bell to come in. I'll wait. Well, he's working with someone else. Well, could you send the next person in so that I can ask them? And so when all 3 or 4 people come in, I promise you, first of all, you might not have to deal with that if you take your notebook and your pen, because once you start writing, then people kind of stand up and take notice. They don't want you writing down or documenting something that could be deemed inappropriate medical care, or inappropriate or biases in healthcare. If you're writing down some concerns that you're being mistreated for various reasons, they don't want that. And they certainly don't want to be called on it. So I suggest bring everybody in. And if everybody is saying the same thing, write all those people's names down. Okay, well, can you give me your name, please? Can you give me your name, please? Well, why do you want my name? Because when I go back and take my child to Dr. Carla or whoever the pediatrician is, I want to be able to say that I didn't just leave it with Dr. Bell, that I asked, Dr. Fields, that I asked Dr. Lewis, that I asked all of these different people, is this the appropriate course of action? And they all agreed. Then that holds them to accountability. Accountability. It's almost like, let me give you an example. So I might tell my child, I don't know, no, you can't go outside. Then they're like, I'm not in agreement with that, so I'm gonna go ask daddy. Where the daddy say, did you ask your mama? And then I might have to call daddy and like, we all in agreement on this. You're not going outside. You're not going to circumvent me to go outside. Now that's probably on the extreme end, but either the other person is going to say yes and say why, or they all agree to say no and say why. Either way, you need to document it. Not that, how we choose our words. Let me say this, Brenda, it's really important too. I think you need to be calm and collected at all times. And I say that because we can have this fight or flight mentality when it comes to working and helping our young ones, especially our children. You want to be the mama bear, but you can't go and attack all of the coaches at one time. That don't sit well, because your child's still a star player and in the game. So we don't need all the coaches to get upset and decide they're going to quit at one time. We want to make sure that that when we're sharing our displeasure, that we articulate why, or our concerns. Let's just say we have concerns, and offer your own suggestions and ask for feedback from other people. I think it's okay to do that and say that you're going to be sharing it with their doctors.
Yeah. This
Yeah.
is so much good information. And this is a message that we need to, especially like for our new parents. I'm thinking currently of our new parents who are advocating for the first time, who are going to their first ED visit and haven't been empowered with that as well. But we want to, I know with our nonprofit, we host a group, a support group, to where we talk to other moms and parents, caregivers about what we do and see if what we do can help. But we also say, hey, if you need something, you can call me too. Because sometimes, being that forefront, or sometimes you don't have all the words to say. So, and that's where we come also to work together. But that document is so important. We have to document everything, and so that we can refer. And I know a recent visit, I had an ED doctor. He wanted to prescribe something for Braden, and I was like, no, he's had that before, and he didn't have a good reaction. And he was like, well, I don't see that in the notes anywhere. Let me go search. And I was like, no, I remember that visit. So I had my spiral notebooks, and he was looking at me like, is she going to? I said, oh, yeah, it was on this such date. He had this reaction. Oh, we can't have that. So, that is so important. That is so important. But that had to come over time for me to write, to learn, to write down the right things and to understand what I needed to write. So I didn't automatically knew how to do that. But that's, why I am where I am as far as an advocate and in a nonprofit, to be in the role to share, the do's and don'ts, what worked or didn't work, and to share with our families so we can all navigate this system, this complicated system. It can be very complicated. Well, so yeah, document, document, document. The power of the pen, right?
Absolutely. I hate to, and you and I kind of talk about this, but I think we need to, or all of our hospitals and patients and families should do a little bit of research and looking at all of the resources available to them. So being either a part of a family advisory council, and if you're not, you should know who those members are. So like Brenda Greene and I are members. So part of our oath that we took, the agreement that we made, that if we come across patients and families who have concerns and they share them with us, we know also the appropriate persons to send those messages to for immediate consultation. And oftentimes some very appropriate and meaningful positive change happens rapidly. So certainly seek out your patient and family advisory councils. And if all else fails, every medical system has an ombudsman program. So they have people in place for you to give a formal complaint to. I like to let that be certainly the end result. If you really cannot move anything forward. But if you're in the ED and you feel like, well, nothing's going to happen here, you can certainly ask for the phone number and the contact information. And maybe, Brenda, we can share that. Or you can simply pull up the hospital website and look up patient complaints. Right. And say, right, well, I want to, or ask, who do I file a formal complaint with? Nobody wants there to be a formal complaint, because once it's formal, again, the power of the pen and the pad don't just work for you. There is something called power of the pen and pad for them too. Hospitals get ratings. Our emergency room gets ratings, and those ratings are based on several different metrics, but part of it has to do with your experience. So if you are sharing your experience with the right people, good or bad, the hospital gets either a pat on the back and some accolades if everything is going well. And if it's not, there are people who oversee making those corrective actions. It's just that you want to make sure that you are following the steps before you get it to that higher realm of ombudsman.
Yes, and Denean, we're kind of winding down to our little time frame, but this is so much information, and I don't know if I mentioned it that this is the first part of two in a series that we're going to talk about self advocacy and improving our healthcare experience. We've been given a whole wealth of information, and it's just started. There's even more that we can share to, together we can talk, discuss, have Miss Denean come back on and just share some information to how, we can become more empowered as advocates, either for ourselves or for those that we care for. And so this is so important. We have to trust our voice, believe that we are owners, you know,
Mhm.
that we are a valued part of our care team or our child's care team. And we have to embrace that so that we can make sure the outcome is better. And then while we're doing all of this for ourselves, and I think I mentioned it before, we're going to help others. It's going to impact the process, the SOPs of the hospital. If we use the power of the pen and pad, if we
Mhm.
understand the power of communication, um, and use that. And I know I'm going on, but I've heard, complaints from families and caregivers and things like that. And we have to understand that if we're just going to go back home and complain to your best friend or just complain to, somebody outside, or maybe just get so frustrated and don't complain or don't voice what is wrong or even right. It's it's just as important. In order to make change, we need to document it. You need to make sure that we're following the appropriate protocols or the system to where our comments, our concerns, our suggestions will be in a position to be heard or read or received. So that's what we want to do and
Absolutely.
empower our patients and our caregivers. So Denean, I know we still have a lot, but August 3rd, you guys, Denean Greene-Rivers will be back, and she's going to talk again. And we're going to bring in a second half of some amazing tips and points to cover. But Denean, is there anything you want to close with? I know I'm looking at something right now that I know you mentioned when we were talking about. I didn't know if you want to share that part, please, or we want
I
to
think
save that for
just
August.
in closing, when we talk about, advocacy work and self-advocacy and patient and client advocacy, so often we just forget to advocate for ourselves, as caregivers. And I think that's equally as important for you to take care of you so that you can be the best version of yourself for your loved one. If you're not getting enough rest, if you're not getting enough water, you can get brain fog like me. You need to know where it's coming from. If you are if you are constantly moving and going and working, so many parents are working 2 and 3 jobs trying to make ends meet. So many households are still stressed and strained in this. We're saying post pandemic. It's not so post. We're still in this pandemic. But even before the pandemic, you have to earn a living. We have parents who are either going back to school or they're helping to educate their college students, and they're working with and for and advocating for their little high schoolers and middle schoolers and the elementary school. That's a lot of work. A lot of us wear many hats, especially in the last year. Most of us have had to be teacher assistants, not just the principal. I tell people I was the head mistress in charge. I was teaching, I was the principal, I was the nurse, I was the TA, I was all of that. I was the lunch lady. I was making sure I was custodial. I was groundskeeper, and that was just for the education part of it. On top of that, having to take care of everybody else in the household and my family, my immediate four walls, not to mention those friends and family who don't even live under my roof. That's a lot. That's a heavy plate. And we often, as particularly Black women, you know, I know there's some dads out there. There are probably a lot of two-parent households, but even in two-parent households, you almost feel like you're one parent. You carry a lot on your shoulders, and I think you need to give yourself a little grace. Be okay with doing that. Have a little staycation. Shut the door. Do those bathroom breaks. You know, step away from your kid and recognize when they're having a good moment, you need to take yours. When they are well today, you take your reprieve. You step away, you call a girlfriend, you get out and walk and exercise. Look at your own healthcare needs. Because if you're not here, then you're going to have to train somebody else to do what you think you're going to do, or what they might do. And it still may not be to your standards. So we don't want any other, you know, general managers coming in, no other owners having to step in because you have expired, because you are overloaded with stuff, you know? So give yourself a break. Give yourself a break, some grace.
Oh, absolutely.
Brenda, thank you. Thank you for having me. And I mean, I am a huge fan of the Be Strong group. And for any of your listeners and viewers, if you're not giving blood, if you can't give blood, find somebody who can. It's as simple as that. Our people need blood.
Oh,
They need
absolutely.
blood for various reasons. And this is a great way to give your support to the Be Strong group. So thank you for that. And if you can't give blood, give your money and time. Your time, talent, and treasure, we will accept that. Is that okay with me saying that, Brenda?
Oh, absolutely. That was not a paid endorsement. That was all genuine. We thank you. We appreciate you, Denean. We look forward to you coming back and sharing some more gems with us on August 3rd at our next Tuesday chat, right here live streaming. And for everyone who's listening live, thank you for listening. Thank you for your comments. Thank you for, there's a lot of wow, that's powerful. Yes, all of the above. I mean, powerful. Those are comments that we see, and it really is. And this conversation is so important to me. So, and those who are listening on the replay, if you have any comments or if you have any questions of Denean, you can still include them in the chat, and I'll make sure I'll get them to Denean, and we'll get you a response. But go ahead and put August 3rd. 6 p.m. Right now, we're streaming live on Facebook and our YouTube channel. Hey, I need some subscribers, y'all. Go subscribe to the YouTube channel. But,
Absolutely.
thank you. Continue to follow us on all of our social media, Twitter, Instagram, Facebook, of course. We have an event coming up to kick off Sickle Cell Awareness Month in September. As Denean mentioned, our event will be Cycle for Sickle Cell as well as a blood drive. We still have slots. We're signing people up. If it's hard for you to sign up, send me a message and I can put your name by a time of your choice. But again, it's been a pleasure. Thank you to everyone. Thank you to Ms. Denean. We appreciate you. Thank you to my team on the back end for this production.
Oh, yes, production. We love production.
I appreciate you so much. And we'll see you guys next time on August 3rd. Hey, I might pop up with a live in between there just to update you guys. So stay tuned.
Thank you.